Ever get a bill from the doctor and just think like, how did they even come up with this number? You're not alone.
Yeah.
The U.S. healthcare system, it's a maze.
It is a maze.
And today, we're going to dive deep into one of its most crucial but often overlooked aspects, medical transcription.
Okay.
Think of it as like the secret language of healthcare, turning spoken medical jargon into those written records that guide your care.
Right.
Huge thanks to London Heartbeat CD Academy in the UK for providing the materials for this deep dive.
Oh, awesome.
They really know their stuff.
Yeah, they do.
So most people only experience this system from the patient perspective.
Right.
But behind the scenes, there's this whole army of medical transcriptionists working tirelessly to make sure every diagnosis, every treatment, every detail of your health journey is documented.
Absolutely.
Accurately documented.
It's so important.
So let's walk through that patient journey. You wake up feeling awful, suspecting it's more than just a common cold.
Right.
What's the first hurdle you face?
Well, first you have to get an appointment.
Oh, yeah.
And depending on the specialist you need and your location, it could be weeks before you can even see a doctor.
Oh.
And then once you get that appointment, you're confronted with mountains of paperwork.
Oh, the paper.
Asked to register as a new patient.
It's like they want to make sure you're really committed to being sick.
Yeah.
Yeah.
All of that information's crucial for your care, though.
Oh, yeah, definitely.
It helps the providers understand your medical history, your allergies, insurance coverage, all that good stuff.
That's true. And then before you even see the doctor, there's the financial discussion.
Oh, yeah.
Copays, deductibles, insurance verification.
It's enough to make your head spin.
Especially when you're not feeling well.
Especially when you're not feeling well.
And then you finally see the doctor, you get examined.
Mm-hmm.
Maybe you have some tests run.
Yep.
But the paperwork still doesn't stop there.
No, it doesn't.
Not even close.
There are prescriptions to fill follow-up appointments to schedule. And then, of course, the billing process begins.
So,
navigating all those insurance claims, medical bills can be a real challenge for people.
Yeah, it really can.
Right.
And that's where medical transcription comes in.
Exactly.
This is the bridge between all of those spoken interactions, diagnoses, treatment plans, and the clear written records that just ensure everyone involved in your care is on the same page.
It really is that bridge. It's so important.
Imagine a world without medical transcription.
Oh, gosh.
You've got doctors dictating notes on the go, nurses jotting down observations, lab results scattered across different systems.
It would be chaos.
Oh, it'd be a recipe for disaster.
Yeah.
Accurate documentation is not only essential for effective treatment,
right,
but also for legal protection and insurance claims.
Absolutely.
So medical transcriptionists are like the unsung heroes.
They are.
Creating order from that potential chaos.
Yes.
They listen to recordings sometimes filled with rapid-fire dictation, complex medical jargon,
all of it,
and translate it into clear, concise, and accurate written documents.
It's amazing what they do.
So we've established that medical transcription is vital.
Yes.
In this complex healthcare ecosystem.
Absolutely.
But what about the reports themselves?
Right.
I imagine there's a whole library of different types, each serving a unique purpose. So let's start with one that you've probably heard of, the History and Physical, or H&P.
Yes, the H&P.
This is like a detective's case file.
Yeah.
It's gathering all the clues about the patient's health.
It is.
So who creates this?
The admitting physician will dictate this H&P.
Okay.
Often when a patient is first admitted to the hospital or starting a new course of treatment.
Okay.
And it captures the patient's chief complaint.
Okay.
Like what brought them in, along with their present illness, their past medical history, family history.
Wow.
Social habits.
It's very thorough.
Even a review of different body systems.
So it's building a complete medical profile.
That is the goal. The H&P lays the foundation for understanding the patient's overall health.
Okay.
And helps to guide the treatment plan.
Okay, now sometimes a patient's condition requires specialized expertise.
Right.
Which is where consultation reports come in.
Yes.
So if I have a heart problem, a cardiologist would be called in and their findings would be documented in this consultation report?
Precisely.
Okay.
The admitting physician requests the consult, and the specialist then will examine the patient.
Okay.
Reviews their records and provides an expert opinion. And then the consultation report summarizes all of their findings, their diagnosis, and recommendations for treatment.
So it's like adding a specialist detective to the case?
It is.
And what about surgical procedures? I imagine those require a completely different type of report.
You're thinking of the Operative Report or the OP report?
Yeah, the OP report.
This is a very detailed account of what happens during the surgery from start to finish.
Okay.
It includes pre- and post-operative diagnoses,
Hmm.
a step-by-step description of the procedure,
Wow.
information about the anesthesia that's used, and any complications that were encountered.
So it's like a meticulous record of everything that transpired in the operating room,
Yes, it is.
which is obviously crucial for patient care, legal reasons, insurance purposes.
All of those things. Accuracy is paramount in an OP report.
Definitely.
It serves as the definitive documentation of the surgical event.
Now, when a patient's ready to be discharged from the hospital, there's another crucial report, right?
There is.
The one that summarizes their entire stay.
That's the Discharge Summary,
Okay.
or the DS.
This
This acts as a comprehensive wrap-up of the patient's hospital journey.
Gotcha.
It includes the final diagnosis, a summary of their treatment and progress medication instructions, recommendations for follow-up care, and even arrangements for any ongoing assistance they may need.
It's like a roadmap for the patient's continued care after they leave the hospital,
It is.
ensuring a smooth transition back to their regular routine or to a different care setting.
Exactly.
But it's not just about hospitals, right?
Yeah.
There's a whole world of diagnostic tests and procedures that also require detailed reports.
Absolutely. We have radiology reports,
Okay.
which detail findings from imaging procedures like X-rays, CT scans, MRIs, ultrasounds.
Wow.
And these reports are prepared by radiologists
Okay.
who are specialists in interpreting medical images.
So it's not just about taking the picture. It's about analyzing what those images reveal
Right.
and translating that information into a written report.
The radiology report provides that crucial interpretation of the images,
Okay.
highlighting any abnormalities that are seen, suggesting potential diagnoses and guiding treatment decisions.
It's like having a detective who can see through walls.
Yeah.
What about when a doctor needs to examine a tissue sample, like a biopsy?
That's where the pathology report comes in. And this is generated by a pathologist, a specialist who examines tissue samples under a microscope
Gotcha.
to identify any abnormalities or diseases.
So the pathology report is like a microscopic investigation,
It is.
searching for clues at the cellular level.
You got it.
And then we also have laboratory reports,
Yes.
which summarize the results of various lab tests. And these provide a snapshot of the patient's health,
They do.
analyzing things like blood counts, cholesterol levels,
Right.
presence of certain substances in the blood or urine.
Yep.
It's incredible to think about the sheer volume and variety of these reports
I know, it's a lot.
being generated every single day.
It is.
Really highlights the crucial role that these medical transcriptionists play in maintaining accurate and accessible patient records.
It's so important.
And that brings us to the skills needed to excel in this profession.
Okay.
It's not just about typing fast.
No, it's not.
Requires a unique blend of linguistic, precision, medical knowledge,
Right.
and meticulous attention to detail.
Absolutely.
So what are some of those essential skills?
Okay.
What does it take to be a successful medical transcriptionist?
Well, first and foremost, you need a strong command of the English language.
Okay.
You know, medical reports require impeccable grammar,
Mm-hmm.
spelling, punctuation.
Mm-hmm.
You know, any ambiguity or error could have serious consequences
Oh, definitely.
for patient care.
It's like being a language detective,
It is.
making sure every word is in its right place.
Yeah.
Every sentence conveys the intended meaning with absolute clarity.
Absolutely.
And beyond language skills, you need a genuine interest in the medical field.
Yes, you do.
You'll be immersed in medical terminology, procedures, diagnoses. So a fascination with that subject matter will keep you engaged and motivated.
It will. If you don't have that interest, it's going to be really tough.
Yeah, I imagine it would feel like deciphering a foreign language
It would.
if you weren't at least a little bit intrigued by the world of medicine.
Yes, you have to have some interest in it.
You'll be constantly encountering new terms, abbreviations, concepts. So a thirst for knowledge and a willingness to learn are key.
Absolutely. Medical transcriptionists need to be lifelong learners,
I agree with that.
constantly updating their knowledge as the field evolves.
Definitely. And speaking of constantly evolving, strong research skills are crucial.
Yes.
You'll encounter unfamiliar terms or procedures,
Right.
and you need to be comfortable digging into medical dictionaries, online resources, maybe even textbooks
Yeah, all of those things.
to ensure accuracy in your transcriptions.
Yes.
So it's not just about transcribing what you hear, it's about understanding the context,
Right.
researching unfamiliar concepts,
Mm.
making sure that the information that you're documenting is completely accurate.
It's so important.
So you really are like a medical detective,
You are.
piecing together the puzzle of each report to create this complete and accurate record.
Absolutely.
In today's world, computer proficiency is a must.
Yeah.
Medical transcriptionists use specialized software for transcription editing file management.
Right.
You'll need to be comfortable navigating these different programs,
Mm-hmm.
using keyboard shortcuts,
Yeah.
and ensuring that your work is securely stored
Mm.
and easily accessible.
Absolutely.
So technology plays a huge role
It does.
in the work of a medical transcriptionist,
It really does.
constantly evolving and shaping the way they work.
Yeah, embracing new technologies and adapting to changing software is essential for staying current.
Absolutely. Now, let's not forget about listening skills.
Oh, that's a big one.
Medical transcriptionists spend a lot of time listening to these audio recordings.
Yeah.
And they're often filled with complex medical jargon, background noise, sometimes even challenging accents.
It's true.
So it takes more than just good hearing.
It does.
It requires active listening focus and the ability to decipher even the most mumbled dictation.
You have to be able to tune out those distractions.
Yeah.
And focus on the speaker's words and accurately transcribe even in less than ideal audio conditions.
Talk about a test of focus.
It
is an
is.
attention to detail.
Right.
And speaking of details, accuracy is paramount in medical transcription.
Yes.
So attention to detail has to be a top priority. A
Absolutely.
single missed word,
Right.
a misplaced comma, or an incorrect number could have significant consequences
They could.
for patient care.
Right.
So these medical transcriptionists are like the guardians of the patient's medical record.
They are.
They're the ones that are ensuring that every piece of information is correct and complete.
Yes.
And because the field of medicine is constantly evolving, a commitment to lifelong learning is essential.
Absolutely.
New treatments, technologies, and terminologies are emerging all the time.
Yeah.
So medical transcriptionists need to stay up to date to make sure their skills remain relevant
Right.
and their work remains accurate.
So important.
So it's not a career for those who want to stand still.
It's not.
It requires a growth mindset, a genuine passion for learning,
Yes.
and a willingness to constantly adapt and improve.
It does.
And we can't forget the physical demands.
Right.
Medical transcription often involves sitting for extended periods.
It does.
So you need stamina and you need that ability to maintain focus.
You do. It's not just a mental workout.
Yeah.
It's a physical one, too.
It really is.
Yeah, it requires both mental agility and physical endurance to excel.
Well, we've covered a lot of ground in this first part of our deep dive.
We have.
From the complexities of the U.S. healthcare system
Right.
to the crucial role of medical transcription
Yeah.
and the diverse skills needed to thrive in this profession.
Absolutely.
We've gained a fascinating glimpse into this often hidden world,
We have.
but we've only just scratched the surface.
That's true.
We'll be back with more after a short break.
Okay.
And don't forget to check out London Heartbeat Z Academy on Facebook, Instagram, Spotify, and YouTube for more insights into this fascinating field.
They're a great resource.
They have been an incredible resource for us, and they offer a wealth of information for anyone who's interested in medical transcription.
Awesome.
We'll be right back.
Okay. Welcome back to our deep dive into the world of medical transcription.
So we were talking about how medical transcription isn't just about fast typing,
Right.
but it's this blend of accuracy knowledge
Yes.
and a keen ear. So what else is crucial for success in this field?
Well, one often overlooked skill is research.
Okay.
Medical terminology can be incredibly complex.
Well, yeah, for sure.
And even seasoned transcriptionists
Right.
will encounter new terms, abbreviations, or procedures they've never heard of before.
So they need to be comfortable digging into those medical dictionaries,
Absolutely.
online resources,
Yes.
maybe dusting off some old textbook
All of that.
to really make sure they understand.
Yeah, and it's not just about looking up words in isolation.
Right.
You know, they really need to understand the context. So they might need to research a specific surgical technique or a particular medication or the latest diagnostic criteria for a certain condition
Yeah.
just to make sure that they're transcribing it accurately.
So they're part medical transcriptionist, part medical detective.
That's a great analogy.
Always on the hunt for clues
That's right.
to make sure they get it right.
Yes.
And in today's world, technology plays such a crucial role in healthcare. So computer proficiency is non-negotiable.
It is.
Medical transcriptionists work with specialized software for transcription editing and file management.
Yeah.
So they really need to be comfortable navigating all these different programs Using keyboard shortcuts.
Absolutely.
Making sure that their work is securely stored.
Yes.
And easily accessible.
Imagine dealing with dozens of audio files, patient records reports every day.
Oh my gosh, yeah.
You have to use technology efficiently to stay organized and productive.
Absolutely. And speaking of those audio files, that brings us to another crucial skill.
Okay.
Listening.
Yes. Listening is so important.
Medical transcriptionists are dealing with recordings that can be so challenging.
They can be. Think about it.
Yeah.
Doctors dictating notes on the go.
Okay.
Maybe between patients or even while they're driving.
Oh, God.
There could be background noise. There could be accents, rapid speech.
Right.
And then you throw in the complex medical jargon.
Oh, yeah.
It's a lot to decipher.
So it takes more than just good hearing.
It does.
They need those active listening skills and the ability to just really focus amidst those distractions.
They have to be able to decipher what's being said, even if it's mumbled or spoken with a strong accent.
Right.
And they can't let those distractions impact the accuracy of their transcriptions.
Talk about a test of focus.
It is.
And attention to detail.
Yeah, and speaking of attention to detail, that's another essential skill for medical transcriptionists.
Definitely, accuracy is so important in this field.
It is paramount. One misplaced comma, a misspelled word, an incorrect number could have significant consequences.
For a patient's care.
Absolutely.
It's a huge responsibility.
It is.
Ensuring that those medical records are a true and accurate reflection of the patient's health journey.
They're guardians of the patient's story.
Wow, yeah.
Making sure that the information is reliable and complete.
Now, we've talked about the importance of lifelong learning in this field.
Yes.
So what are some ways medical transcriptionists can stay updated on those latest medical advancements?
Well, there are a lot of resources available.
Okay.
Professional organizations like the Association for Healthcare Documentation Integrity, or AHDI, they offer continuing education courses, webinars, and conferences.
So they can learn about new medical technologies, procedures, and keep their skills sharp.
Absolutely. And it's not just about formal education.
Right.
You know, reading medical journals, staying informed about industry news, and even just following relevant medical blogs can help them stay ahead of the curve.
It really is a career that requires constant curiosity and just a genuine passion for learning.
It does.
Now let's shift gears and talk about technology's impact on this field.
Okay.
We all know how rapidly technology is evolving.
It is.
So is voice recognition software a threat to the future of medical transcription?
That's a question that's often debated.
Yeah.
While voice recognition has made great strides, it still really struggles with the nuances of medical language.
Okay.
Especially with accents, background noise, and that vast array of specialized terms.
So it sounds like human medical transcriptionists still have a very vital role to play, even in this age of artificial intelligence.
Absolutely. They bring a level of accuracy, understanding, and attention to detail that technology alone just can't replicate.
That's true. They can catch errors that software might misinterpret, ambiguous phrases, and just ensure that the overall quality and the clarity of the medical records are top-notch.
Yes, they can.
That's reassuring to know that human expertise is still so highly valued in this field.
It is.
But how do you think the role of the medical transcriptionist will evolve alongside these advancements?
Well, it's interesting to think about.
Yeah.
Some experts believe that medical transcriptionists might shift towards more of an editor role.
Okay.
Reviewing and refining the output of voice recognition software.
Okay.
And ensuring its accuracy and completeness.
So instead of transcribing from scratch, they're kind of polishing the AI's work.
Exactly. And using their expertise to catch any errors or inconsistencies.
That makes a lot of sense.
It highlights how adaptability and a willingness to embrace new technologies will be key for success in this field.
Yeah, you hit the nail on the head.
Technology will continue to evolve.
Right.
And those who embrace lifelong learning and adapt to these changes will be the ones who thrive.
Now let's talk about the different types of medical reports.
Okay.
We touched on a few earlier.
Yes, we did.
But I'm curious to dive a little deeper into those specific challenges that each one presents to a medical transcriptionist.
All right, let's start with the history and physical, or the H&P.
Okay.
This is often the first comprehensive record of a patient's health.
Right.
So it lays that foundation for their care.
And we talked about how it covers everything from the patient's chief complaint to their medical history, family history, and even social habits.
Right, all of that.
So what are some of the unique challenges of transcribing an H&P?
Well, one challenge is just deciphering the physician's dictation style.
Oh, okay.
Some doctors dictate very clearly and concisely,
Right.
while others might speak rapidly. Oh gosh, yeah. Use complex medical jargon or even mumble.
So the transcriptionist really needs to be adaptable, and able to decipher a variety of speaking styles,
Yes, they do.
and making sure that that final report is accurate and easy to understand.
Absolutely. And because that H&P is often created during a patient interview,
Right.
there might be interruptions, background noise, or even overlapping conversations that the transcriptionist needs to navigate.
Oh, wow. So they need to be masters of focus and selective listening,
They do.
filtering out those distractions and capturing only that essential medical information.
Exactly.
Another challenge with H&PS is the potential for inconsistencies in the patient's narrative.
Yes.
So the patient might provide conflicting information about their symptoms or their medical history.
Right.
And the transcriptionist really needs to be able to recognize these discrepancies
They do.
and flag them for the physician's attention.
It's important.
So they're not just transcribing words, they're
Yeah.
analyzing the information, looking for potential errors or inconsistencies that could impact the patient's care.
They play a crucial role in ensuring the integrity and accuracy of that medical record.
Now let's move on to the consultation reports.
Okay?
These are generated when a specialist is called in to provide their expertise on a specific issue.
Right.
So what are some of the unique challenges transcriptionists face with these reports?
Well, consultation reports often delve into highly specialized areas of medicine.
Okay.
So the transcriptionist might encounter unfamiliar terminology, complex procedures, or even cutting-edge research that requires additional research and clarification.
So they need to be comfortable with the language of all these different medical specialties
They do.
and be willing to just dig deep into unfamiliar territory to ensure accuracy.
Yes, they might need to consult specialized medical dictionaries, research articles, or even reach out to the physician for clarification.
It's like being that medical detective,
It is.
constantly piecing together clues and solving linguistic puzzles. And because these consultation reports are often used to guide treatment decisions,
Right.
accuracy is paramount.
It is. The transcriptionist needs to be incredibly meticulous, double-checking their work and ensuring that every detail is correct.
It's a huge responsibility, knowing that their work can directly impact a patient's health and well-being.
Absolutely. Now let's talk about operative reports, or the OP reports.
Yes,
These are incredibly detailed accounts of surgical procedures.
they are.
And accuracy is absolutely essential.
And we talked about how they include everything from the pre- and post-operative diagnoses to a step-by-step description of the surgery.
Right.
So what are some of the specific challenges of transcribing an OP report?
Well, one challenge is the sheer volume of information.
Okay.
Operative reports can be quite lengthy, sometimes spanning multiple pages.
Wow.
And they often include complex anatomical terminology, surgical instruments, and technical descriptions of the procedure.
So the transcriptionist needs to be able to maintain focus and accuracy over these extended periods,
Yes,
ensuring that every detail is captured correctly.
absolutely. And they need to be comfortable with surgical terminology,
Right.
which can be quite different from general medical language.
It's like learning a whole new vocabulary,
Is.
specific to the world of surgery.
Yes, and because those surgical procedures are often time-sensitive,
Okay.
there's often a sense of urgency in transcribing these OP reports.
Right.
The surgeon might need that report quickly to make decisions about post-operative care or to document any complications that arose during the procedure.
So they need to be able to work efficiently under pressure
They do.
while maintaining a high level of accuracy.
It's a demanding but crucial role, ensuring that the surgical record is complete, accurate, and readily available when needed.
Now let's shift gears to discharge summaries,
Okay.
or the DS.
The DS.
These reports summarize the patient's entire hospital stay,
They do.
providing a roadmap for their continued care after they leave the hospital.
Right.
So what are some of the unique challenges transcriptionists encounter with these reports?
Well, discharge summaries can be quite comprehensive,
Yeah.
covering a wide range of medical information from the diagnosis and treatment to medications and follow-up care instructions.
So they need to be able to synthesize all this information
Yeah.
and present it in a very clear and concise manner.
They do. They need to ensure that the report is easy to understand for anyone involved in that patient's follow-up care,
Right.
including the primary care physician specialists and even the patient themselves.
So it's like creating this concise but comprehensive summary of a complex medical case,
It is.
highlighting the key takeaways.
Yes.
And ensuring that everyone is on the same page.
Exactly. And because the discharge summary often serves as a transition document,
Right.
guiding the patient's care in different settings, accuracy is paramount.
Definitely.
Any errors or omissions could have significant consequences for the patient's health and well-being.
So again, a lot of responsibility.
Yes, a lot of responsibility.
Attention to detail,
Absolutely.
making sure the information is reliable and complete. Now let's move on to reports from those diagnostic tests and procedures.
Okay.
These include radiology reports, pathology reports, and laboratory reports.
Right.
So I'm curious to delve a little deeper into those specific challenges.
Okay.
Let's start with the radiology reports.
All right, these reports interpret those medical images,
Yep.
like the X-ray CT scans and MRIs,
Mhm.
providing those valuable insights into a patient's condition.
So the transcriptionist needs to be able to understand the language of radiology,
They do.
accurately transcribe the radiologist's findings and interpretations.
They need to be familiar with the anatomical terminology, the different imaging techniques, and the various terms used to describe abnormalities or pathologies.
So it's like translating a visual language into a written one,
It is.
ensuring that the information is clear and accessible to those other healthcare providers.
Exactly. And because those medical images can be complex and nuanced,
Right.
the transcriptionist needs to be able to capture the radiologist's precise observations and interpretations, avoiding any ambiguity or misinterpretations.
Accuracy is key, as these reports often play a crucial role in diagnosing and treating a variety of conditions.
Absolutely. Now let's move on to pathology reports.
Okay.
These reports analyze tissue samples,
Okay.
looking for abnormalities or signs of disease.
So the transcriptionist needs to be comfortable with that language of pathology.
Yes.
Understanding the different types of cells and tissues, and the various terms used to describe their appearance and behavior.
They need to be able to accurately transcribe the pathologist's microscopic findings,
Okay.
including the descriptions of the cell morphology, staining patterns, and any abnormalities detected.
It's like transcribing a microscopic investigation,
It is.
capturing those really detailed observations and analysis.
Absolutely. And because pathology reports often play a key role in diagnosing serious conditions like cancer,
Right.
accuracy is paramount. The transcriptionist needs to be meticulous, double-checking their work, ensuring that the information is reliable and complete.
It's a responsibility they don't take lightly.
No, they don't.
Knowing that their work can directly impact a patient's diagnosis and treatment plan.
Absolutely. And finally, let's talk about laboratory reports.
Okay.
These reports summarize the results of various lab tests,
Right.
providing those valuable insights into a patient's health status.
So they need to be familiar with all the different lab tests,
They do?
their units of measurement, and the normal ranges for various values.
Exactly. They need to be able to accurately transcribe those numerical results, as well as any interpretive comments or flags from the lab.
So it's like translating this language of numbers and scientific data
It is.
into this clear and concise report
Absolutely.
that other healthcare providers can easily understand.
And because lab results can be crucial in monitoring a patient's condition, identifying potential problems and guiding treatment decisions, accuracy is essential.
Wow, we've covered a lot of ground when it comes to those different types of medical reports.
We have.
And the unique challenges each one presents to a medical transcriptionist.
It's a lot.
It's clear that this profession really requires a diverse skill set,
Yes, it does.
a commitment to accuracy,
Absolutely.
and a genuine passion for that ever-evolving world of medicine.
You've summarized it perfectly.
And let's not forget that crucial role they play in ensuring the smooth functioning of the healthcare system
Yes.
and the well-being of countless patients.
Absolutely. Their work often goes unseen, but it's an integral part of providing quality patient care.
Before we wrap up this part of our deep dive, I want to give another shout out to London Heartbeat's Z Academy
Yes.
in the UK for providing us with the incredible materials for this episode.
They really are a wealth of knowledge for anyone interested in medical transcription.
They are rock stars.
They are.
For our listeners who are eager to learn more, don't forget to check out London Heartbeat's Z Academy on Facebook, Instagram, Spotify, and YouTube.
Yes, they've got tons of resources and insights that can help you explore this fascinating field.
It's been a pleasure delving into this topic with you.
It has been a...
Welcome back to the Deep Dive. We've journeyed through the U.S. healthcare system, explored the vital role of medical transcriptionists, and deciphered the secrets of medical reports.
We have. It's been quite an adventure.
And now, as we reach the final leg of our deep dive, let's turn our attention to the future. What does the career landscape look like for aspiring medical transcriptionists?
That's a great question.
Is this a field with staying power, or is technology going to make human transcriptionists obsolete?
Well, the good news is the Bureau of Labor Statistics projects a steady need for healthcare workers, including medical transcriptionists, in the coming years.
Okay, so it's a career path
Yeah.
with promising job security
It is.
and growth potential.
Absolutely. The aging U.S. population and the ever-increasing demand for accurate and timely medical documentation mean there will be a need for skilled medical transcriptionists. But that doesn't mean the field is static.
Right, we've talked about those advancements in voice recognition technology.
Right.
So how might that reshape the role of the medical transcriptionist in the future?
It's fascinating to consider. Some experts believe that medical transcriptionists might transition into more of an editor role,
Okay.
reviewing and refining the output of voice recognition software, ensuring its accuracy and completeness.
So instead of transcribing from scratch, they're kind of polishing the AI's work.
Exactly. Using their expertise to catch those errors or inconsistencies.
Okay, that makes a lot of sense.
Yeah.
It really highlights how adaptability and a willingness to embrace new technologies will be key for success.
You hit the nail on the head. Technology will likely continue to evolve, and those who embrace lifelong learning and adapt to those changes will be the ones who thrive.
So for those listening who are intrigued by this world of medical transcription, what advice would you give them? What are those essential steps to breaking into this field?
Well, a solid foundation in medical terminology and anatomy is a must.
Okay.
There are a lot of online courses and resources available to help build that knowledge base.
What about formal training programs? Are those essential?
They can be extremely beneficial. A lot of community colleges and vocational schools offer certificate or diploma programs in medical transcription.
Yeah.
These programs provide structured training covering everything from keyboarding skills and medical terminology to transcription software and industry best practices.
So they equip aspiring transcriptionists with those technical skills and knowledge they need to hit the ground running.
Exactly. And many of these programs also include internships or practicum experiences, which can be invaluable for gaining real-world experience and building connections.
Speaking of connections, networking is always important.
Yes, it is.
So how can aspiring transcriptionists connect with others in the field?
Professional organizations like the Association for Healthcare Documentation Integrity, or AHDI,
Okay.
they offer networking opportunities, conferences, webinars, and even job boards.
So a chance to learn from experienced professionals, stay updated on industry trends, and even explore potential job opportunities.
Absolutely. And don't underestimate the power of online networking. Joining LinkedIn groups or participating in online forums dedicated to medical transcription can be a great way to connect with other professionals, share insights, and learn from each other's experiences.
It's all about building that community,
It is.
tapping into the collective wisdom.
Yes.
And one final piece of advice:
Okay.
never stop learning.
So true.
This field of medicine is constantly evolving with new treatments, technologies, terminology
Sorry.
emerging all the time.
Yeah.
So a thirst for knowledge and a commitment to lifelong learning are essential.
Couldn't have said it better myself. Embrace that curiosity, never shy away from a challenge, and always be willing to expand your knowledge base.
So it sounds like a career that's both intellectually stimulating and personally rewarding, knowing that your work contributes to better healthcare outcomes
It is. It truly is.
for countless patients.
Yes, and I want to emphasize that even in an increasingly digital world, that human touch remains irreplaceable.
It does. That human ability to understand context, interpret those nuances, and ensure accuracy is what makes medical transcriptionists so vital.
They are vital members of the healthcare team.
And speaking of vital members, a huge thank you to London Heartbeat's Z Academy in the UK for providing the fantastic material that made this deep dive possible.
Their insights have been so valuable.
They have been. For our listeners, don't forget to check out London Heartbeat Z Academy on Facebook, Instagram, Spotify, and YouTube.
They have a treasure trove of knowledge and resources.
It has been an absolute pleasure exploring this fascinating field with you. And for our listeners, we hope you've enjoyed this journey into the world of medical transcription. Remember, it's a field filled with opportunity, driven by a passion for accuracy and dedicated to improving patient care. Until next time, keep those minds curious and never stop exploring.